ठीक है. So what is rhinoplasty? It is the surgery. It is plasty. जहाँ पे word आ गया, it is always the surgery. So rhinoplasty is the surgery of the nose. Septoplasty is the surgery of the septum, which is a part of the nose. So this is your nose. So you should know this is the nasal tip in the midline in the center. और ये सारा जहां हम फिंगर ऊपर से लेके नीचे तक टच करते हैं, दैट इज द नेजल ब्रिज और कॉल्ड द डॉर्सम, नेजल डॉर्सम. Then sides of the nasal tip is the nasal ala. In between the two openings, the openings are called nostrils. So in between the openings is the skin called columella. And on the top, in between the eyes, the central part is called the radix. So basically the upper one third or upper part is made of the bone. It is called, if you touch your nose, so upper part is made of the nasal bones. So there are two in number, right and left. And the lower part, your nasal tip and the central part of the nose is made up of the cartilage. So in the cartilage, you have the upper cartilages. So there are two in number on each side. So it is called upper lateral cartilages. And below is the lower lateral cartilages, also called the LR cartilage. And in between the two nostrils, inside the nose, it is not visible from outside. In between, there is a wall called the septum. So septum is the wall made up of bone and the cartilage, which separates the two nostrils. Yes, so this is from inside the nose. So you might get this question. You have to draw the nasal septum. So nasal septum is made up of 5 or 6 things. So this part, blue part, is called the nasal cartilage. So we have to harvest this cartilage. This is very important. From the septal cartilage, we just need a L-shaped strut for the nasal sport. आपके नोज में ऊपर ऊपर कार्टिलेज हो और फ्रंट पे हो एल शेप, दैट इज सफिशिएंट फॉर योर नोज. जो नीचे वाला डीप इनसाइड वी कैन हार्वेस्ट, वी कैन टेक, दिस इज द एक्स्ट्रा कार्टिलेज गिवन बाय द गॉड. सो प्लास्टिक सर्जन्स कैन टेक दिस part of the lower cartilage from the septum and use it in some part of the rhinoplasty. Then the green part, this is above the septum, above the cartilaginous septum, there is a bony septum made of the ethmoid, and behind there is a vomer bone. So these are the two bones which are part of the septum. And last is the maxillary crest. Lower down, the brown part is the maxillary crest, and interior most part of it is called the anterior nasal spine. ये आप columella के अंदर feel कर सकते हो. This is the sharp bone. So what is rhinoplasty? It is a plastic surgery procedure conducted on the nose. So purpose is to correct and reconstruct the form. So correct or reconstruct. Suppose you had an accident and your nasal bones are broken and your nose is deformed, or in some boxers when they hit on the nose. So we have to reconstruct. Second is restoring the function. So function of the nose is breathing. So breathing is most vital thing, just as heart pumping. So breathing is also important, and nose is the main key, and the function of nose is breathing. So restore the breathing, because the septum, if the septum is deviated, your one side of the nose will be blocked from inside, and outside you can see your nose is deviated. So what are the consequences of the septal deviation? एक तो नाक बाहर से देखने में टेढ़ा लगेगा आपको, आपको अच्छा नहीं लगेगा, फोटोज अच्छी नहीं आएंगी, नाक टेढ़ा है. और अंदर जो आपकी नोस्ट्रिल्स हैं, आप फिंगर डालोगे तो एक साइड की अंदर जो नोस्ट्रिल है, ओपनिंग है, वो बंद होगी. थर्ड इज द एस्थेटिकली एनहांसिंग द नोज. This you can see from many models. और आजकल तो हमारे पास बहुत patients आते हैं, they want their nose to look beautiful, so we do for aesthetic reasons and any other medical purpose. These are very rare. So broad classification, we divide rhinoplasty into surgical and non-surgical. So most important is the surgical, so we do the surgery. So rhinoplasty is among the most difficult of all cosmetic surgeries. It is a procedure that needs only to be performed once in a patient's lifetime if carried out properly. So rhinoplasty, sometimes we get the patient जिन्होंने कहीं और से rhinoplasty कराई होती है from any ENT doctor, or if the doctor is not experienced, so it is very difficult to do the revision rhinoplasty the second time. The surgery is for a couple of hours. It takes around 3 hours and is always done under general anesthesia. Because अगर nose में कोई bleeding होती है, that can tickle inside your respiratory passage into the trachea, into the lungs. So in general anesthesia, they will put a tube into your trachea that is called endotracheal tube, and there is a bulb of it that is inflated inside the trachea. So कोई भी ब्लड है या कोई लिक्विड है नोज के अंदर से वो लंग्स में या ट्रेकिया में नहीं जा सकता, क्योंकि वहां पे ट्यूब डाली हुई है और ट्यूब का भी एक बल्ब होता है, उसको इन्फ्लेट किया हुआ है. सो योर एयरवे पैसेज इज सेफ. Strong and well proportional nasal skeleton is the key to success of the surgery. So nasal skeleton आपका strong होना चाहिए. जैसे हम कोई घर बनाते हैं, आप दीवारों में देखा होगा आर्किटेक्ट बहुत लोहा डालता है ना, छत बनती है उसमें आप लेंटर जब डालते हैं घर का, उसमें लोहा डाला होता है, आयरन रॉड्स डाली होती हैं. सो सिमिलरली इन द नोज, तभी मैं आपको बता रहा था सेप्टम में से हम कुछ कार्टिलेज ले सकते हैं जो हम, मैं आपको बाद में, या दैट इज एडवांस थिंग. सो वी पुट इट इन द फ्रंट ऑफ द नोज, इन द टॉप ऑफ द नोज, so make it a stronger looking. So rhinoplasty is more than just a cosmetic surgery. It also improves the breathing disturbances due to distortion. Distortion of what? Distortion of the septum inside. So benefits of rhinoplasty: it can correct the birth defects or injury. So sometimes you get injured, your nose is deformed, or there is difficulty in breathing. Birth defect means by the God's grace or by birth your nose is deformed. To fix the nose size, if it is longer or shorter, the width and the profile. Profile is if you take the picture from the side view. So fine tuning of the nasal tip. So when you put a finger, you put your index finger on the nose. So this is your nasal tip, which is large. So always it is called in medical terms a bulbous nasal tip. If your tip is round like a ball, or it is very large, it is also called boxy nasal tip or bulbous nasal tip. Drooping, if your nasal tip is drooping down, it is called a parrot beak. कई लोगों की आप nasal tip देखोगे ऐसे नीचे को गिरी हुई है, so that is drooping nasal tip. Or it is too upturned. Upturned means nasal tip बहुत ऊपर है, आपकी nostrils ही दिख रहे हैं, so उसकी भी adjustment होती है. These all comes under nasal tip modification. So you can correct the nostrils. Nostrils is the openings. So there are two, one on each side. So that are very large, that are wide, that are upturned. So किसी को अपने nostrils देखने में अच्छे नहीं लग रहे नीचे से, कि मेरी जो openings हैं वो बड़ी हैं, ज़्यादा large हैं, wide हैं. So उसके लिए भी we do rhinoplasty. So nasal asymmetry and deviation. So this is very common cause. किसी का नाक टेढ़ा है तो he will definitely come for the surgery. Reduce or increase the size of the nose. So nose rhinoplasty can be augmentation rhinoplasty. We can increase the size, or reduction rhinoplasty. We can decrease the size. Change the shape of the tip. As I told you before, tip में बहुत कुछ changes होते हैं. Then change the angle between the nose and the upper lip. Help relieving the breathing problems. So ये functional आ गया last indication. So पहले सारी cosmetic indications है, आपको nose की shape change करानी है, and last is the breathing problem.